Hi everyone, this is teacher Farhana from JVM Campus 1. Now, as the country goes into a dire situation of hospital beds running out, a lot of doctors are prescribing people to stay at home and take care of COVID at home. Now, it's important to understand that not everybody needs hospitalization if you have COVID. A lot of treatment and good treatment can happen at home. So I thought let's bring you some home care tips for COVID-19. If you have contracted the virus, if you have somebody in the family who has contracted the virus, what are the few quick things that you can keep in mind and they are essential to follow? Number one is isolate. That is absolutely necessary. In your house, if you have anybody tested positive, in fact, even if the result is not out, even if you have tested COVID negative, if you are showing symptoms, you have to isolate. So if you have symptoms like fever, if you have cough, if you have sore throat, if you have muscle pain, you have nausea, diarrhea, loss of smell and taste, and even if you have discoloration in your nails and hands, this is the good indicator that you have contracted the virus. Even if you are testing RT-PCR negative. In that case, first up, isolate yourself. If you only have these symptoms and you do not have shortness of breath, then that means you are a mild patient, and mild patients can completely recover at home. If you start reporting shortness of breath, that's when the situation gets a little serious and you should get in touch with your doctor and he will decide if you have to go to a hospital or you can get an oxygen concentrator at home. Next, you have to ensure that you are fully equipped. That means you have to have an oximeter, you have to have thermometer inside the house. Best things to do is make a chart for yourself. Take your temperature and your oximeter readings at least twice a day. Tabulate that, put that on a piece of paper and share that with your doctor. You need to have a physician looking into all your symptoms even if you are at home. Share those details with him. He will obviously put you on a medical medication. Follow that up. But there are a couple of other tips. I thought I will bring that for you. Some tips like drinking lots of fluids is absolutely necessary if you are COVID positive. Steam inhalation, extremely important. Warm gargles have proved to be very good. Also washing hands with soap or hand wash frequently. The things to remember if you are COVID positive at home, or say if you have a family member who is COVID positive and he or she is isolated in one particular room, ensure that there is only one person in the family who is the caregiver, meaning one designated person who double masks and is the one giving him or her food all the time. The things to remember here is that your linens, your utensils should not be exchanged. Everything that is there inside the room of the isolated person should not be mixing up with the rest of the family members, which will lead to further spread. So these are the things that you need to keep in mind. But very importantly, there are some red flags as well. If you are going to show the following symptoms, you must report your doctor immediately. Like the minute you notice a dip in your oxygen levels. If your oximeter says that your oxygen concentration is below 92%, then contact your doctor immediately. If you have slurred speech, tell your doctor. If you have weakness in your limbs, which is beyond what you were experiencing earlier, if you have acute pain as a headache, if you have difficulty in breathing, and if you feel a chest pain, as well as feel this pressure on your chest, mostly on your heart is where you're feeling the pain, and if you have a sort of bluish discoloration on your lips and on your face, immediately contact your doctor. He will tell you what to do. The things to remember is Do not panic when you get COVID. Yes, we are under a massive healthcare crisis. Hospital beds are running out. Oxygen is running out. Medical infrastructure is completely overburdened. The onus is on you to keep yourself safe, and that's number one. And even despite you get the virus, start by following some of these tips over here. Get in touch with the doctor. Don't be in a sudden rush to get to the hospital.